Okay, let's talk about nipple care. So sometimes when you're breastfeeding, you can experience cracked nipples, sore nipples, or bleeding nipples. And I just want to share with you guys a little bit about how to take care of them. So if you're already experiencing them, you want to make sure that you're cleaning gently with, I'd say, maybe a damp rag after every feeding. So when you have any of these things going on, you want to clean them gently to reduce the risk of infection. You can also use an antibacterial ointment, or you can use a medical grade lanolin, and you can get this over the counter at any drugstore. I'm pretty sure you can get it at Amazon, Target, Walmart, again, any store like that. And I showed you the kind that I have, even though there are a variety of different kinds that you can pick up. I have the Medela Tender Care, and they all pretty much work the same. They're supposed to be no pain, no scabbing, and completely safe for baby to feed on. There's also hydrogel pads, which you simply, literally, I don't have any pads with me right now, but you literally just, there's an adhesive in the back, you peel it off, stick it on the breast, and it's supposed to provide instant cooling and soothing to the nipple. You can keep these on for up to 24 hours, throw them away, put some more on. If the ointment isn't working, if the hydrogel pads aren't working, hydrogel, Hydrogel pads, you can Google it so you can pull it up to try to purchase them. So if taking the right cleaning precautions isn't working, like I said, gently cleaning, damp rag, wipe it off, use ointment, use hydrogel pads. If any of these things aren't working and you're still bleeding after, cracked or bleeding after 24 hours, I would say call a doctor, see what they might say, maybe even a consulting nurse first. And if it's like really severe, I would definitely go in and see what a doctor might say. Sometimes if a baby has thrush, which is like a yeast infection of the mouth, this can transfer over to mom's breast. I've actually been through this experience one time with my first kid, where I did not know what in the world was going on, but I went into his pediatrician to let them know. It could have been about his thrush, but I don't really remember. Anyways, we went in, and I let her know what was going on with me and breastfeeding. I think maybe we were having a hard time breastfeeding. But anyway, pediatrician even prescribed me a low-dose antibacterial ointment that healed over the course of, I would say, maybe 5 to 7 days. The other thing is, so we went over the hydrogel pads, the right hygiene, and the ointment, and then go see a doctor. You can even talk to a lactation consultant so that they can teach you how to pump properly to preserve your milk. You also want to, if you can, it's really strongly encouraged to continue pumping on that breast if you can. If the pain's too severe and you cannot handle it, don't worry about pumping. Feed baby on the other side. Give the injured side time to heal. But if you can pump, then I would strongly encourage to pump, because you don't want your milk supply to go down. I know it's like, well, I'm injured, and you know, breastfeeding is literally a whole lifestyle. So you have to really get ready for this, and you have to know what to do. So I would say continue pumping on that side if you can. If you can't, give it a break. It's totally fine. Allow that side to heal up, or at least to scab up, and then continue feeding. And then sometimes if you have a scab and then you go to pump on that, once it's scabbed up, it can break the scab. So if you're concerned about that, I wouldn't pump yet until maybe the scab was gone or it's like completely healed. And then it's totally okay if you have cracked or bleeding nipples and baby wants to still nurse. It's totally safe to still nurse baby with cracked or bleeding nipples. It won't harm baby. If anything, they might get a little blood in their mouth, but I mean, that's to the extent of what baby's going to get from all of this. You're the one that's going to be feeling all the discomfort. You can also do heating packs or cooling packs, whatever might help you get through this. I hope I've covered everything. I feel like I've covered everything. I'm sorry, I'm just looking at my notes. Sometimes I have to have notes because I have to remember exactly what I'm going to say, how I'm going to say it. But absolutely, we talked about thrush. We talked about, sometimes, this is a big one, dry skin. Keep your nipples moisturized. So, to prevent some of this, you can make sure that after every feeding you are applying some type of moisture, maybe olive oil, coconut oil, maybe the Tender Care cream. Do that, or it's not cream, it's ointment. Apply some of that to the nipple after every feeding or pumping to prevent cracked or dry skin. That's one way to prevent all of this from happening. So if I didn't cover everything or you have any questions, feel free to leave a comment and I will reply with the best answer that I have for you. That pretty much wraps up this portion of nipple care. And if, like I said, if you have any questions or comments, feel free to leave them. I'm always available.